Good day, everyone. My name is Sophia Dennis. My group members and I will be presenting on medication management in the community. As we know, many of us take more medication as we age. Our group will be highlighting some strategies for medication management in the geriatric senior population. This presentation on medication management guide is designed to empower seniors, caregivers, and family members with helpful information to maximize the benefit of medication while reducing the risk of medication errors and drug interactions. There is no question that medication are incredibly important for treating patients with acute and chronic conditions. However, with approximately 50% of patients taking medication incorrectly, it is vital that hospitals and clinicians consistently follow best practices. This helps ensure patients take their medication the right way so their health care can improve, or at the very best, they can better manage their condition. Medication management is a service to help patients manage their medication so they take them as prescribed and avoid the adverse effects associated with incorrect medication administration. Thank you.
Hi everyone, good morning. My name is Alwyn Pennant. I'm a student at Broward College in the Oriented BSN program. And today I'm out in the field and I'm here with Miss Pamela Carswell, who is living in the Lauderhill community, Park South 1, which is the 55 and over community. Hi, Miss Pam, how are you?
I'm good, thank you.
Okay, good. So today we are going to be talking about Senior's Guide to Medication Management. So medication management is a safety precaution that is designed to empower seniors with helpful ways to maximize the benefits of medication while reducing the risk of medication errors and drug interaction. Effective medication management starts at home. As a patient, you are an essential part of the healthcare team, and educating yourself on the medication you take and ways you can be more involved in medication management starts at home with you as the patient. Now, as with all medication and all information, make sure you seek guidance from your healthcare providers, your doctor, and your pharmacist. One of the first things we'll be starting out with is reading medication label. As with this medication here, when you read your medication label, make sure your medication has your name on it. Mm-hmm. The instruction, which is to take 1 tablet by mouth daily. Yeah. Daily means it could be in the morning or in the afternoon. So always follow your doctor's instruction. And with this medication, 40 milligram is the amount, is the dosage, and your doctor's name on it, Dr. McLean, and the quantity. Also on the back of most medication, it comes with what the medication look like, which this one is saying oval yellow, okay? And the total amount of medication should also be on your tablet, quantity 30 tablets, okay? And it also give you a discard date. Make sure you pay attention to that, which is right here, okay?
Yeah.
You see?
Oh, yeah.
Okay, good. Okay, so all medication come with a label, and the label contains the basic information, okay? Now, when you take your medication, make sure you take it either in the morning or in the afternoon. So there are some medications that are taken either in the morning, like some people call it your water pill. That you normally want to take that in the morning compared with nights. Okay, so make sure you be mindful of what medication you're taking and what time of the day that you can take it. Make sure, I know a lot of people likes to take their medication one time, even the morning ones during the morning, and that's a no-no. You take your medication according to your doctor's prescription, according to your doctor order. Medication safety tips. Don't take anyone else's medication. Make sure you take your own medication. and you don't allow anyone to take your medication either, because that's a hazard. That's a safety hazard, right? One of my thing about organizing medication is the shoebox system, and the shoebox system is a shoebox where it is nice and bright and colorful. Like say, this one is brown, but at least inside it is as a big orange color. But you see the shoebox, you remember, oh, I got to take my medication. Another part of that also is the pill box. You use your pill box to sort your medication out, and that will let you know that what day, what time you should be taking your medication. Okay? Now, before you take your medication, especially hypertensive medication, make sure you take your blood pressure, which you have here. And you said you take your blood pressure this morning?
Yeah.
And what was it?
It was 19 over 60.
109 over 60. And the doctor said that normally that's a good blood pressure for you to take.
Yeah.
Okay. And I've seen you take your blood sugar this morning, and your blood sugar was 126,
Yeah.
right? And you take your blood sugar medication before you take your metformin,
I
right?
haven't taken it as yet.
And you haven't taken it as yet. Okay, good. So we went over, Miss Pam, medication safety, such as not to take medication that belongs to someone else, take your own medication, and to take your blood pressure before you take especially your hypertensive medication, and to do your blood sugar check, which I've seen you done before you take your metformin. Okay, are you comfortable with your shoebox system and how to sort your medication out?
Yes.
Okay, good. So this is a gift from us to you, which is the pill box. I don't know if you have one, but this is yours now.
Okay.
And I brought this shoe box especially for you, so you can have it. I will be leaving this pamphlet with you, and it is about medication management and how to take your medication. Okay? Is there any question that you have for me?
Well, I just want to thank you, for dropping by
Oh, you're welcome.
and educating me more about my medication. Thank you so much.
You're welcome. There you have it, guys. And of course, Miss Pam had given us permission to put her on YouTube. Do we had a verbal permission? Is that right?
Yes.
Okay, good. So have her on YouTube. All right. Thank you, guys. You have a great day. And that was it. Have a good one.
Hello, my name is Kaylee Chiata, and I'll be discussing effective medication management. Effective medication management necessitates collaboration. You play a crucial role in your healthcare team, underscoring the importance of educating yourself on ways to actively participate in medication management. Success hinges on open communication with your healthcare provider to ensure prescriptions align with your current health status and adjustments are properly implemented when necessary. Rather than assuming medications are permanent once prescribed, it's essential for your doctor to stay informed about any health changes that could impact the need for medications, potentially reducing or eliminating them altogether. Regular check-ins with your healthcare team, whether in person, via telehealth, or a quick call to the nurse, facilitate ongoing monitoring and adjustments between appointments. Doctors and pharmacists aim to make medication instructions clear, yet for many seniors managing a combination of prescription and over-the-counter medications, the task can be daunting. Safely balancing these medications requires careful reading of each label to comprehend their mechanisms and necessity. Understanding how each medication functions, whether it's for short-term relief or long-term therapy, empowers individuals to make informed decisions. Every medication includes a label with essential details. When reviewing a new medication, it's crucial to meticulously read the label for information on dosage, timing, potential interactions, and other critical considerations. It's essential to maintain an updated and comprehensive list of all medications, including prescriptions, over-the-counter drugs, vitamins, and supplements, detailing dosages and reasons for use. This list serves as a valuable reference during healthcare appointments and helps prevent potential interactions. Regular medication reviews with healthcare providers are crucial to reassess the necessity of each medication, monitor for side effects, and adjust treatments as needed, especially when health conditions change or new medications are prescribed. Using tools like pill organizers or medication dispensers can also simplify daily routines and reduce the risk of missed doses.
Hello, everyone. My name is Jonathan Castellanos. I'm in the RN to BSL program at Broward College. I'm just going to be picking up where Alwyn was doing his interview with his elderly patient. For medication management for elderly patients, it requires a thoughtful and individualized approach due to various factors. One of the key principles to consider for teaching elderly patients about medication management is comprehensive medication review, conducting a thorough review of all medications, whether it be prescription, over-the-counter, or supplements, regularly to assess appropriateness, potential interaction, and adherence. It's also important to simplify regimens, like minimize the number of medications whenever possible to reduce pill burden and the risk of medication errors. Consider functional status, take into account the patient's functional abilities. For example, if they have mobility dexterity when selecting dosage forms, liquid formulations, or easy to open containers. Also start low and go slow, initiate medications at lower dose and gradually titrate upwards to achieve the therapeutic goals. Particularly for medications with narrow therapeutic index or potential for adverse effects. Also monitor for adverse effects, be vigilant for adverse drug reactions which may present differently in elderly patients. Adjust medications properly if adverse effects occur. Tailor the goals of care. Align medication management with the elderly patient's goals of care, especially in advanced age or terminal illness. And consider factors such as quality of life and symptom control. When educating the patients and caregivers, it's important to provide clear instructions on medication use, potential side effects, and signs of adverse reactions, such as Alwyn did. Ensuring caregivers are informed and capable of assisting with medication administration if needed. And also, it's important to address their cognitive impairment. Adapt strategies for patients with cognitive impairment due to enhanced medication adherence, such as simplified dosing schedules or the use of adherent aids, such as pill boxes. Regular monitoring and follow-up. It's important to schedule regular follow-up visits to monitor medication effectiveness and adherence and any changes in the patient's health status or medication needs. And also coordinating care, ensuring communication and coordination among all healthcare providers involved in the patient's care to optimize medication management and avoid duplication or conflicts in treatment plans. Thank you.
Hello everyone, my name is Elmis Flowzy. I'm a student at Broward College RN to BSN. Today, I'm going to be talking about medication management conclusion. In conclusion, effective medication management is crucial for optimizing patient outcome and safety. By adhering to best practices, such as thorough patient assessment, clear communication, and vigilant monitoring, healthcare providers can minimize risks and enhance therapeutic benefits. It is imperative to foster a collaborative approach among healthcare professionals, patients, and caregivers to ensure medication adherence and mitigate potential adverse effects. Ultimately, prioritizing comprehensive medication management not only improves patient health, but also promotes a more efficient healthcare system overall. I would like to say thank you for everyone that participated in medication management.